Well, good morning, everyone. My name is Krista Rial. I'm one of the health educators with the Communicable Disease Service at the New Jersey Department of Health, and I would like to welcome you to today's webinar on tick-borne diseases. This training is designed for local health department staff, clinicians, and vector control personnel. The topics we will cover in this 1-hour presentation include tick biology, surveillance and control, human disease trends, and health education. We have 4 speakers for today's webinar. Kim Cervantes is with the New Jersey Department of Health. Andrea Ajizi works for the Monmouth County Tick Lab and Rutgers University. And Jim Ossie is also with Rutgers. And as I mentioned before, I am with the Department of Health. So we have 4 objectives for today's webinars: to name major tick species in New Jersey and then explain a little bit about tick ecology and tick biology. We're going to talk about current and previous tick surveillance methods in the state. We're going to go over some of the human tick-borne disease trends we see in New Jersey. And then we're also going to give you some education resources and strategies to promote tick-borne disease prevention. So there are continuing education credits for this webinar. There's 1 public health credit, and there's also pesticide recertification credits. So that's 8A and 8B. Credits are provided only to those who are attending the webinar live. We are recording this webinar, so we will post it on a website, but only those who view the webinar right now in the live version will be able to get credits. For those who are claiming public health credits, please note that you need to be registered in both GoToWebinar and NJ. So that's where you're going to get your public health credits. If you have any questions during the webinar, feel free to type them in using the questions section. You can see over there on the right-hand side. And go ahead and type them in. You can type them in at any time, but we will go over questions at the end. We have the slides printed for you in a PDF version, and they're right there under the questions in the handout section. So if you either want to follow along or want to print the slides, go ahead and get them in the PDF version that's in the handout section. And for those of you on NJ, the handouts are also posted in the NJ Practice Exchange. So after today's webinar, you're going to be sent a link to the evaluation. You need to do the evaluation if you're going to claim credits, either public health credits or the pesticide recertification credits. You have 5 days from the time that the evaluation is sent to complete that, and those who do not complete the evaluation will not receive credits. So just another quick reminder, for the public health credits, need to be registered on both GoToWebinar and NJ. Need to do the evaluation, and attendance for the webinar is going to be verified both on NJ and GoToWebinar. So without further ado, I will hand it over to Jim Ossie, who is going to talk a little bit about tick ecology and biology.
Good morning, everyone. Let's get started. Go to the first slide. The topics we're going to cover today: the major tick species in New Jersey, tick ecology, where and when ticks are found, and tick biology, feeding, reproduction, and life stages. So these are the 3 most abundant indigenous species to New Jersey. On top, we have the black-legged tick, Ixodes scapularis, also known as the deer tick. And the large one with the red abdomen is the female, in the middle is the male, and on the right is the nymph. In the middle panel, we have the American dog tick, or Dermacentor variabilis, the female, and then the male. And on the bottom panel, we have the Lone Star tick, Amblyomma americanum, female, male, and then nymph. There are other species of tick in New Jersey, but these are the most commonly encountered. This is just a comparison slide, so you can see 2 more common species up close to one another with the safety pin, and that scale on the bottom is in millimeters. So here we have a female Dermacentor variabilis, or American dog tick. Here we have a male. 2 nymphal black-legged ticks, a male black-legged tick, and a female black-legged tick. Note that the American dog ticks are larger and their bodies are ornamented, I should say. And whereas Ixodes is not ornamented. Here we have another common species, Amblyomma americanum, also known as the Lone Star tick. Here we have the female, which is the most recognizable tick in New Jersey with the white spot on her back. Here we have a male. Here we have a nymph. Here we have a partially engorged female, and these two females are fully engorged. So these fully engorged females used to look like this female, so they take in a lot of blood. And just a comparison slide of a Ixodes scapularis, the vector of Lyme disease and the Lyme bacterium, with the head of a straight pin. The nymphs are very small. And how small are they? So you often hear that ticks are the size of poppy seeds. Well, which tick is the size of a poppy seed and which stage? So let's go through the top. We have a nymphal black-legged tick, a male black-legged tick, a female black-legged tick, and in the middle of this image we have 4 poppy seeds from my Sunday bagel. Here we have, on the bottom, we have Hemiphysalis longicornis. On the left we have a nymph, and on the right we have a female. And Andrea Agizi is going to talk more about that tick. So let's go to the first poll question. Which stage of the black-legged tick is the size of a poppy seed? Select one: egg, larva, nymph, or adult. Okay. Are we good? Okay.
There we go.
Ah, there it is. Okay, most of you got it right. It's the nymph. And that's a problem because they come out now and they're so darn small that it's very difficult to see, especially if you have freckles or a person of color. They're very difficult to see. Okay, next slide. Again, how small is a black-legged tick? This just puts things in perspective. So here you can see in the lower panel, there is the nymph right there on my hand, back of my hand, and that's just a dime as a comparison. Again, just beware how small these things are. All right, let's briefly go through the life cycle of Ixodes scapularis, the black-legged tick. And although the other hard ticks we find in New Jersey have a similar life cycle, there are differences, but we're going to use this as a model to explain how ticks go through their life cycles. So here we have about in the spring, we have the eggs being laid. You can see my arrow moving. And they hatch in the late summer as larvae. Note the larvae are 6 legs. They'll feed on a small mammal, usually in this part of the country, and then go into dormancy in the leaf litter and from fall and winter and come out the next spring, right about now, as a nymph. If that larva last summer picked up a spirochete from its reservoir host, that black-legged tick nymph will maintain that spirochete all the way to adulthood. So again, this nymph comes out in the spring. It has to look for a host and feed. It'll feed for 3 to 4 days, and if it's infected with the Lyme spirochete, it will more than likely infect that host, especially if it's a white-footed mouse. Its success with other hosts varies. Some are not very easily infected, others are. So after this nymph feeds for 3 to 4 days, it falls off the host and comes out the very same year in the fall as an adult. And the adults usually look for larger hosts, and it's usually only the female that feeds. The male will not feed. And note that overall, in general, if you go to the sidebar on the right, there are 4 stages of the tick. There's egg, larva, nymph, and adult. They feed once per each stage. And as I mentioned, if a tick feeds on an infected host and becomes infected, it will carry that infection to subsequent stages and then can infect new hosts. So here's these two pictures illustrate a great place to find black-legged ticks. You'll see in the top panel, it's very green and there's a lot of leaf litter and vegetation. That's a great spot for the nymphal stages and the larval stages. Nymphs in May through July and the larvae August through September. They're very sensitive to drying out, so that's why they prefer these areas. And if you go to the bottom panel in the fall colors, that's when the adult comes out. That coincides with the rut of the white-tailed deer. So they're looking for white-tailed deer, and therefore they come out during the mating season when the deer are running around looking for mates. So we're going to transition to a different tick now. This is Dermacentor variabilis, also known as the American dog tick, unofficially known as the wood tick. The official common name is American dog tick. And this is a beach on Long Beach Island. I was told by the township not to mention where, but I'll tell you offline if you really want to know. Long Beach Island, and I collected 194 Dermacentor variabilis in about 40 minutes right on this beach. It's a much different environment than Ixodes scapularis. The Dermacentor variabilis can handle the desiccation of the beach in the sun. And if you go down below to the lower panel, I collected 55 American dog ticks in Stoke State Forest. So here we have the ticks right along the road. I was first shocked by this, but now I'm pretty used to it. So the third tick we were talking about is Amblyomma americanum, the Lone Star tick, and we usually find this tick in the southern part of the state. So the top panel is Amblyomma americanum. I collected 51 nymphs and 16 adults in about 20 minutes in Tuckerton in Ocean County, and this is right along a little side road here. The parkway is in the background back there, the Garden State Parkway. So you don't have to be deep in the woods to find these things. And in Monmouth County, there's a park called Shark River Park, where you can find all three species that we have been speaking about, Dermacentor variabilis, and Lone Star ticks, and American dog ticks. So let's discuss briefly how a tick finds a host. Most of the ticks we have around here are ambush feeders, and what they do is they wait for a host to come by. If you'll see on the top left panel, we have two dog ticks sitting on a very large blade of grass in Shark River Park. If you were to blow on them with your breath, you'll see they would raise their arms like the two lower images, the lower panels. One is a female Ixodes scapularis, the other is a female Lone Star tick. And they put their arms in the air because they have carbon dioxide sensors in their forelegs so they can figure out where you are. So once you come in contact with that tick, whether it's brushing up against it or laying down in the grass or walking through the grass, they'll try to climb up aboard you. So they can't jump, hop, skip, or fly. They have to have direct contact. And the first thing they usually do is crawl upwards. The next thing they do is try to find a good spot to feed. And after that, we go to this top right panel, and on the you can see my pointer there. The first thing the tick does is dig in with these chelicerae, and they will cut through the skin like a reciprocating saw. And then if you move over to this panel, the tick will then insert the hypostome and begin to draw blood. And they feed for a number of days. They're not like mosquitoes. So if we look at the next slide, we have feeding and pathogen transmission. So on the left panel, we have 4 plates, nymphs feeding through the course of 4 days. And you can see they take a while to feed and they fill up with blood. But during this time, not only are they salivating, but they're also regurgitating because they have to get rid of the things that they don't want or else they would burst. And a feeding tick is not like a syringe. It's more complicated than that. There's a phenomenon called saliva-assisted transmission, and in the tick saliva there are vasodilators, platelet inhibitors, anticoagulants, thrombin inhibitors, and kinases. So the nymphs feed for 3 to 4 days, as I mentioned before. But if you look at the right panel on the bottom, we have a series of female image is a female scapularis. Right here on the left, we have the red one. That's unengorged. Next one is partially engorged. And these three over here are fully engorged. They have to mate just in order to fully feed and replete and become replete. So this white one here did not mate yet. So therefore, she will not feed to completion. The point being, they have to take in a lot of blood. And these things, these fully engorged ticks, again, used to look just like this. So poll question number 2, true or false? Ticks feed just like mosquitoes and can complete blood feeding in less than a minute. Okay, responses are coming in. And looks good. 94% of you got it right. Very good. They feed for a number of days, not like mosquitoes. Okay, so that's the end of my talk. I think I just want to show this final image of an old publication from Ticks in New Jersey. And it was, I think, in the 1950s or 60s. And that was published by Extension Service of Rutgers Agricultural Department. And on the right panel, we have, I think there's 9 Dermacentor variabilis hanging off one blade of grass, and that's in Voorhees State Park in Hunterdon County. If, in fact, you live out there, just be careful. Thank you.
Hello, good morning, everyone. I'm Andrea Jeezy from Monmouth County Tick Lab. I'm going to be talking about tick surveillance in New Jersey, starting in the past and moving towards the present. So before Lyme disease, there was really no one doing any systematic tick surveillance in New Jersey. And in fact, black-legged ticks were not even known to occur in the state at this time. If you can see from this publication from 1938, they list the ticks that are known to occur in New Jersey, and that includes the American dog tick, the rabbit tick, the Lone Star tick, the woodchuck tick, and the brown dog tick, but there is no mention of black-legged or deer ticks. After Lyme disease, the first Lyme disease case in New Jersey occurring in 1978, the first statewide tick surveys were done. And these were done taking advantage of deer check stations. And these are places where hunters would bring their killed deer to be recorded by DEP. And researchers could hang out and remove ticks from the deer and use them for further research. Now, this is not a perfect survey because you only get the ticks that are attached to deer. But it does allow sampling of a wider geographic area than dragging in collecting that large number of ticks in a shorter amount of time than going out and collecting in each location that a deer could cover. So what these surveys showed was that black-legged ticks expanded north in New Jersey between 1981, when they were mostly limited to the southern 2/3 of the state by elevation, and then into 1987 they had expanded to cross that elevation boundary. The last statewide survey for ticks from hunter-killed white-tailed deer was done in 2002. Unfortunately, deer check stations have since been discontinued, so this method of tick surveillance is no longer available. But what we learned from the survey, which also tested the ticks from pathogens, is that there's a significant difference in infection prevalence between the different New Jersey regions, with the coastal plain, and that's at the bottom here in pink, having significantly higher infection rates of 3 of the 4 pathogens than the Skylands region, which is up here in orange. And the 3 pathogens that had the higher infection prevalence in the coastal region was Borrelia burgdorferi, that causes Lyme disease, Babesia microti, that causes babesiosis, and Anaplasma phagocytophilum, that causes anaplasmosis. So the reason for this is a legacy of the northward expansion of black-legged ticks that we observed in the 80s. This is because when ticks arrive in a new geographic location, it takes time for the pathogens to catch up with them. So the pattern that we observed here makes sense knowing the expansion history. Although it's interesting to note that, as Kim will talk about later, most of our tick-borne disease cases are in the northern part of the state here, which has lower infection rates, at least as of 2002. Another thing we learned from this statewide survey is that Borrelia miyamotoi was present in all regions of the state as early as 2002. Borrelia miyamotoi is a relapsing fever Borrelia, so it's related to the bacteria that causes Lyme disease, but it's in a different subgroup, so it causes a different kind of illness, and which Kim will talk about later. But because it is not a reportable disease, we don't always have the best records of human cases, so this is an area where tick surveillance can be quite useful to understand the distribution in the state. And although it was at a low percentage, 2.7% overall, the fact that it was in all regions as early as 2002 is interesting to note. So unfortunately, we don't have any more statewide surveillance data to report after this 2002 survey because there is no statewide tick surveillance program in New Jersey. At present, Monmouth County is the only one with tick surveillance, and we have 3 different programs. We have an active surveillance program, which entails going out and collecting ticks from the field and testing them for pathogens. We have a passive surveillance program, which is our tick ID service for residents, where residents can bring in ticks to get identified, and we give them a nice report like this with information that they can then use and take to their physicians if they develop symptoms later on. And we also have education, including several brochures on protecting your family and pets, what to do if you find a tick, and tick ID cards and magnets. So next I'm going to talk about primarily our passive surveillance program and what we've learned about tick encounters in Monmouth from 10 years of data. So who gets bitten by ticks? We have 7,725 ticks acquired in Monmouth County between 2006 to 2016 and brought to our passive surveillance program. 95% of them came from humans, 5% dog, pretty even split between the sexes. But the interesting thing is 44% of our samples came from children ages 0 through 9. And we don't know, because of the way the surveillance was done, we don't know if this means that children are more likely to get ticks or if ticks on children are more likely to be brought to us because the parents are concerned. So that's something to keep in mind when looking at the rest of the data, that half of our submissions come from children 0 to 9. So looking at where do people get bitten, 59% of them from around the home, so almost 60% around the home. That followed by the next most common location is parks, 24%. And looking at the activity where the tick was acquired, recreation accounts for 70% of our submissions. And remember, these are reported by people, so it means this is where the people thought they got their tick and what they thought they were doing when they got it. So that's subject to biases in itself. But the recreation made up 70% and followed by yard work at 21%. And if you remember that almost half of our submissions came from children, children probably aren't doing that much yard work. So if you analyze the data for individuals over age 50 separately, over half of individuals over age 50 acquired their ticks doing yard work. So we're just going to have a quick poll. And the question is, during which month of the year are you safe from ticks? April, September, December, or none of the above? So great job, guys. I didn't trick you. I tried, but I didn't succeed. So the answer is none of the above. And the reason is that adult black-legged ticks can be active even in December. Anytime the weather warms up just enough for them to be able to come out and quest, they will. So there's really no month that you can assume that you'll be safe from ticks. And as we'll see on my next slide, we do get tick submissions from residents year-round. The majority of the submissions are in the summer, the warmer months, the summer, but we do get submissions in every month. So in this graph here, this is what we typically, the red dashed lines denote what we typically call tick season, and that's May through August. But really, you can get ticks, as I mentioned, in December, in November, even in January and February, sometimes if you have a mild spell of weather. And the other thing you can see from this graph, which is broken down by species, is the different species submissions that we get correspond to the activity peaks of those different species. So for example, the Lone Star ticks in the green line, they're mostly active March through September, October. The dog ticks in blue are mostly active March through August, and the deer ticks are in purple, and they have the two different peaks corresponding to nymphs versus adults. So looking at which ticks are doing the biting, and starting back in 2006 and looking towards the present, you can see it's really changed a lot over time in Monmouth County. So in 2006, the majority of our submissions were black-legged ticks or deer ticks. And over time, that didn't really, the number of deer ticks getting submitted did not really change very much. But then we started around 2012 to get a large number of Lone Star ticks submitted. And it's switched so that now the majority of our submissions are Lone Star ticks. And American dog ticks have also been increasing in recent years as well. So why are we concerned about the increasing numbers of Lone Star ticks? Well, first, it's expanding north in the state. So this is the last survey that was done for Lone Star ticks. This is a presence-absence survey. And you can see that in the southern part of the state, those red dots mean the tick was found, and the green dots that are mostly in the northern part of the state mean that the Lone Star tick was not found. And you can see there's kind of a border in the middle of Monmouth County over here, where the southern part of the county has Lone Star ticks and the northern part doesn't. And we have data from our active and passive surveillance programs showing that around 2012, we started to get a lot more Lone Star ticks being submitted from the northern part of the county, and they are present in lots of field sites in the northern part of the county now as well. So it expanded north, at least in Monmouth, if not further in the state, but we don't know beyond our boundaries. Another reason to be concerned is Lone Star ticks have been having a longer season in recent years. So I mentioned Lone Star tick season being, April until September or even October. It used to be more May through August. So in recent years, they've been coming, starting earlier and sticking around longer. So that is something of concern. And finally, Lone Star ticks are more likely, compared to deer ticks, they're more likely to come in as nymphs, which we know is important from a health risk perspective because nymphs have had a chance to feed and pick up pathogens, and yet they're really small, so they're easy to miss. So the fact that we're getting significantly more Lone Star ticks as nymphs compared to black-legged ticks is concerning. And as well, significantly more Lone Star ticks are coming in fed, meaning they've had time to potentially transmit a pathogen to a resident. So the implications of this are because Lone Star ticks transmit Ehrlichiosis. And so we did some calculations using our data in Monmouth to figure out how often should we expect to see Ehrlichiosis given the relative tick abundance of Lone Star ticks compared to black-legged ticks and the relative infection rates of each with their respective pathogens. So using our data, we calculated that Ehrlichiosis should occur about 0.6 times as often as Lyme disease. So to put this in context, in 2016, we had 492 cases of Lyme disease. And our expected number of Ehrlichiosis cases is therefore 0.6 times 492, or 297 Ehrlichiosis cases. However, we only had 6. So this is telling us that our potential residents' exposures to Ehrlichia are much higher than what we're seeing come in as cases. And this could be due to underreporting because Ehrlichiosis has nonspecific symptoms. It doesn't have that characteristic bullseye rash that Lyme disease has. It could be that it's a very mild illness and most of the exposures end up being asymptomatic and therefore don't seek medical attention, or it could be a mix of both. So the last thing I'd like to mention before I move away a little bit away from our tick surveillance data is that human tick encounters do not always reflect field abundance. So what this slide is showing us on the left here, the graph of passive surveillance submissions is the light green line here. And on the right axis is field collections, and that's these dark green bars. So what we're comparing here is that between 2006 and 2016, there was not a significant increase in field collections from this field site, which happens to be Naval Weapons Station Earl. However, there was a significant increase in our passive surveillance submissions from the towns surrounding that site. So the ticks were not increasing in the field, but they were increasing in our submissions. And this tells us that human encounters with ticks are not as straightforward to predict as tracking tick populations in the field. And this is something to keep in mind when you hear a prediction in the news that this is going to be the worst tick season ever. Well, it's a little more complicated than that. So just because you have a lot of ticks does not mean you will get a lot of human exposure, and vice versa, just because it's a low tick season, if that ever happens, I don't know. But just because there's a low tick season does not mean you will have decreased exposure. So it's not a direct relationship. So switching gears a little bit and talking about some species to watch out for. So Jim covered the species that are most common that we have in the state right now. Looking forward, we're concerned about the potential of Amblyomma maculatum, or the Gulf Coast tick, to expand into New Jersey from the south. It's been slowly moving up the Atlantic coast in the past few years, and most recently was collected in Maryland and Delaware in 2013. So it's possible that they will move into New Jersey at some point. And this is the Gulf Coast tick here, the tick on the left. And as you can see, the markings are very similar to the American dog tick. So it is possible that it could arrive, and without ongoing tick surveillance, it could be overlooked. And the Gulf Coast tick is important because it's a vector of Rickettsia parkeri, and this is a related species to Rickettsia rickettsii, the agent of Rocky Mountain spotted fever. Rickettsia parkeri causes a more mild illness, but it is recognizable by a characteristic eschar rash at the bite site. So that's something to keep in mind. So I have another poll question. So New Jersey residents are most likely to encounter deer ticks when going outdoors. Is this true or false? So of all the ticks they could encounter, they're most likely to encounter deer ticks. True or false? I tricked you guys. Well, not 46% of you, but so the answer is actually false. And this is a trick question because, so sorry about that, but basically it depends on the time of year, it depends on the location in the state, and it depends on the type of habitat. So there are parts of the state where, for example, parts of the state in times of the year where you will be far more likely to encounter a lone star tick than a black-legged tick. There are certain habitats where you'd be more likely to encounter a dog tick than a black-legged tick. So the answer is really it depends. So that's something to be aware of. Okay, so another species to watch out for is the longhorned tick, Hemiphysalis longicornis. And you've probably heard a lot about this tick on the news recently. It's been in a lot of headlines. It was detected first on 100 county sheep last year. The sheep had no travel history, and it had built up to a large infestation on the sheep. And this could have been in part because the tick is parthenogenetic, which means that it can lay eggs that hatch, and it doesn't need to have been mated. So a single female can lay eggs that successfully hatch and become a population. And this could mean that it could increase at potentially a faster rate than other tick species that have to wait to find a mate. So it was detected on the sheep with no travel history, which was concerning. It's native to East Asia. It's invasive in Australia and New Zealand, where it's a large problem for livestock and cattle. So primarily, so it is a potential animal health concern in New Jersey, both because of the potential to vector disease as well as the sheer numbers of this tick. As you can see on the right, this was the ear of the sheep, and you can see there's an awful lot of ticks there. And once you build up to an infestation of thousands and thousands of ticks, this can affect the health of the animal, even without disease being in the picture. And Kim will speak about the human health concerns of this tick when she gives her talk. So looking at longhorn tick detections, as of last week, May 17th, we had a detection in Hunterdon County, and this was the original sheep, as well as in grass in the surrounding property, and it was detected feeding on local wildlife. So there were nymphal ticks found feeding on a wild deer. And this is concerning because once it's in wildlife, the wildlife can spread throughout the state. So Union County is over here, and here it was detected in grass. And in Middlesex County, it was also detected in grass. And I'd like to mention that the type of habitat that we're looking at here is a little bit different than the types of habitat where you would expect to see a black-legged tick, for example. So this is not, this appears to be more of a meadow tick, so more similar to the American dog tick in the types of environments Jim was showing there than for a black-legged tick, which tends to be more in a forest. So we're looking at tall grass, unmowed grass, maybe bordering a forest, but not in the middle of a forest, maybe roadsides and meadows, that kind of environment. So in addition to the 3 locations in New Jersey, it was also detected feeding, there was a single tick detected feeding on a calf in Virginia on May 16th. And currently there's no known connection between how that calf came to have the tick and New Jersey, so that's being investigated. And another thing I'd like to point out, and this is Jim's picture from earlier, where he was showing the size of ticks. Right now, most of the field collections that we're doing are nymphs. So most of the longhorn ticks we're collecting in the field right now are nymphs. And so we still have a lot of research to do to learn the seasonality of this species and be able to know what life stage to expect at what time of year. But it does seem like it's nymph season right now. So if people are going to encounter this tick, it would most likely be right now nymphs, which is this small stage here. Okay. So the Tick Blitz is an initiative I've been co-organizing with the Rutgers Center for Vector Biology. It was with funding from the Northeast IPM Center. And it was originally organized to look at the distribution of the American dog tick in the state and the rickettsial pathogens that they may be transmitting. And the participants are 21 mosquito control agencies from around the state. And these are professionals that are experts in mosquito surveillance, but due to constraints on funding, personnel, training, et cetera, have not expanded into ticks. So we were interested if we could train them and motivate them to do some baseline tick surveillance in their counties. And what we made it as easy as possible because these folks have full-time jobs doing other things. So we had them take the ticks off of the drags using tape, and that's what you see on the left here in this picture. It's very easy to just pull the ticks off with tape, put them in a bag, and send them to us. And then here's an example of somebody collecting ticks in the field here using a tick. This is called a tick sweep, and it basically drags a white cloth along the ground and ticks will cling onto it. So for the Tick Blitz results, data analysis is ongoing. We have more than 800 ticks that were submitted to us that we now have to identify to species and do pathogen testing. And these are all the sites around the state that we had collections done. So we're very excited to do the analysis and see what we found. Data now, and we're hoping to identify the distribution of American dog ticks, spotted fever rickettsia, and then potentially the Gulf Coast tick and the longhorn tick. Importantly, I'd like to mention this is not a perfect survey. There are a lot of reasons why ticks collected on one day at one time from one location may not be representative of what we would expect to find at that site or in that county. So we really need some sustainable statewide tick surveillance, just like we have sustainable statewide mosquito surveillance, in order to have an early warning system in place for new threats to human and animal health. So stay tuned, and hopefully we'll have the results of the Tick Blitz coming in the future.
Okay. Thanks, Andrea. Good morning. My name is Kim Cervantes, and I'm going to talk a little bit about overall tick-borne disease trends, focus on diseases we see with our 3 primary vectors, and I will talk a little bit about the longhorn tick as well, and what we know in terms of the risk for human health. So CDC issued a vital signs report on May 1st on vector-borne diseases. In the United States, tick-borne diseases in specific doubled between 2004 and 2016. New Jersey is in the top 20% of states having the highest numbers of tick-borne disease cases, and most of these highest incidence states are in the Northeast and upper Midwest parts of the country. All of the highest incidence states reported more than 12,000 tick-borne diseases during this time. New Jersey reported 51,000, and we are third only to New York and Pennsylvania. So this slide is looking at overall tick-borne diseases in New Jersey. They've also increased, although there is variation year to year. One of the reasons for why we see variation is changes in the abundance of ticks that transmit specific diseases. Some of those factors include temperature, humidity, the presence of animal hosts that ticks feed on. In addition, there may be changes in healthcare provider testing and reporting, as well as the completeness of public health case investigation. You can see in 2017, we had 5,682 reported tick-borne disease cases, and that was the highest number reported in the past 13 years. Deer ticks transmit the greatest number of tick-borne diseases, including the 2 bacteria that transmit Lyme disease. Only Borrelia burgdorferi has been detected in New Jersey. Borrelia miyamotoi, which is a relapsing fever, is not reportable, but we have requested voluntary reporting from laboratories and clinicians. Deer ticks also transmit anaplasmosis, babesiosis, and Powassan virus. The graph shows the number of anaplasmosis cases shown in dark blue, babesiosis in green, and then Powassan is shown in gray along the bottom of the graph. I'll show Lyme disease separately due to the difference in scale. All of these diseases show an increasing trend, again with variation from year to year. So this graph is showing the number of Lyme disease cases over time, and you can notice the scale of this graph compared to the previous slide. There were over 5,000 Lyme disease cases reported in 2017, and the Lyme disease cases represent 90% of the total number of reported tick-borne disease cases in New Jersey. So we're going to do a poll question. The question is, why are there so many more Lyme disease cases than other diseases transmitted by the same tick? So A, the erythema migrans rash, because of laboratory testing, healthcare provider and public awareness, the number of infected ticks, or all of the above. Okay, so clearly this was not a trick question, and yes, the correct answer is all of the above. About 80% of patients infected with Lyme disease will have the characteristic erythema migrans or bullseye rash. It's an easily visible indication of a Lyme disease infection. Other tick-borne diseases are characterized by initial nonspecific symptoms, including fever, headache, malaise, and muscle pain, which can be easily confused with many other ailments. Laboratory testing can be challenging for many tick-borne diseases. It often measures the body's antibody response, but it often takes between 7 and 10 days for sufficient antibodies to develop that can be detected through laboratory testing. So as a result, persons tested in the first week after symptom onset may test negative even if they are infected. Since there's so many cases of Lyme disease in New Jersey, there's a high level of awareness of Lyme disease by both healthcare providers and the public. That can affect healthcare seeking behaviors and laboratory test orders. And finally, the prevalence of each pathogen in the ticks varies, and we tend to see higher prevalence of Lyme disease in New Jersey deer ticks specifically. So these maps are showing 5-year incidence rates for the 3 most common deer tick transmitted diseases, anaplasmosis, babesiosis, and Lyme disease. Looking at the number of reported cases between 2013 and 2017 per 100,000 population. The northwest counties of Sussex, Warren, and Hunterdon have the highest incidence rates for all 3 diseases. And not surprisingly, the northeastern counties are among the lower incidence, have the lower incident rates for all 3 diseases as well. Lone Star ticks in New Jersey transmit primarily Ehrlichiosis and possibly some cases of tularemia. Heartland virus is an emerging arboviral disease. It's been detected in Midwestern and Southern states. Studies have also suggested an association between an increased number of milder spotted fever group rickettsiosis cases and the expanded geographic distribution of the Lone Star tick. And STARI, or the Southern Tick-Associated Rash Illness, has been also associated with Lone Star ticks in southern states. The graph is showing the number of cases of Ehrlichiosis in New Jersey over time. There was a spike in cases in 2009, which may have been related to weather and tick prevalence, but there has been a steady incline in the past 4 years from 64 reported cases in 2014 to 102 in 2017. Looking at the American dog tick, that's associated with spotted fever group rickettsiosis, or SFGR, and tularemia. The graph is showing the number of cases of SFGR over time. It isn't clear why there is such significant variation in the number of cases from year to year. But after an average of 57 cases reported between 2013 and 2016, there were 137 cases reported in 2017. Rocky Mountain spotted fever is the most well-known SFGR, and it is a severe tick-borne disease with a high mortality rate if left untreated. However, there are other SFGRs that are transmitted by other vectors and that are known to cause human illness, including Rickettsia parkeri, that Andrea had mentioned, and rickettsial pox, which tend to produce a milder illness. Laboratory testing is complicated by antibody cross-reactivity with other rickettsiosis, some of which may not cause disease at all, and by the presence of persistent antibodies. And CDS will be reaching out to clinicians later this month with recommended testing guidelines to help us better characterize these reported cases. So these maps are showing the 5-year incidence rates for Ehrlichiosis and spotted fever group rickettsiosis. Again, looking at the reported cases between 2013 and 2017 per 100,000 population. The highest rates of Ehrlichiosis are in the southern and central east parts of the state, with the exception of Camden County and including Hunterdon County. And this pattern is consistent with the southern distribution of the Lone Star tick. The SFGR cases are a bit more patchy, with the highest incidence reported in Hunterdon, Salem, and Atlantic counties, and elevated rates reported in Ocean, Gloucester, and Cape May. So Haemaphysalis longicornis, or the Longhorned tick, as Andrea mentioned, was first identified in New Jersey in Hunterdon County in November 2017. At that point, we weren't sure it could successfully overwinter in New Jersey. We now know that it can survive New Jersey winters. We're working to determine where the tick is distributed in New Jersey and what pathogens it may carry that would impact on human health, as well as identifying concerns for livestock. It isn't clear how long the tick has been here or how it first arrived. To date, as Andrea mentioned, it's been identified in 3 counties, but it may be distributed more broadly. And it has recently also been identified in Virginia. New Jersey doesn't have a statewide tick surveillance program as we do for mosquitoes, so it is more difficult to determine the presence and abundance of tick species. Testing so far has been negative for human pathogens. However, we know that when a tick is introduced into a new area, It may take a couple years before the pathogens can become established in the tick animal host cycle. So it's really important to maintain the surveillance and testing efforts. In Southeast Asia, this tick has been associated with a spotted fever rickettsiosis, a viral disease which is genetically similar to Heartland virus, Powassan virus, and a hemorrhagic fever in China. But transmission of all vector-borne diseases requires the presence of a bacteria or virus in the animal host, a competent vector, and contact between humans and those vectors. So the diseases that the tick has been associated with in Southeast Asia may not reflect the risk that the tick can pose in New Jersey. This tick may be just one additional species capable of transmitting tick-borne diseases we already have in New Jersey, or it may be able to transmit a tick-borne disease we aren't yet aware of. The health department is continuing to work with federal and state partners to determine what the impact on human health will be in New Jersey. The Longhorned tick is a known livestock pest in Southeast Asia, particularly in cattle and horses. As such, New Jersey Department of Agriculture and USDA are coordinating the response to its identification in New Jersey. Several activities are underway, including outreach and surveys with livestock owners, large animal veterinarians and slaughterhouses, wildlife surveillance focusing on deer and small mammals, tick surveillance, treatment of highly infested focal areas, providing public information and education for targeted groups, including hunters, and setting up a system for the public to drop off suspected longhorned ticks, which will be sent to the National Veterinary Services Laboratory in Iowa for identification. New Jersey Department of Agriculture has information about the longhorned tick on its website. I've included the link on the slide. Rutgers University also has information, and I've included that link. And New Jersey Department of Agriculture is working on including a process on their website for how the public can submit longhorned ticks for identification. They will also be opening a designated phone line for inquiries, and we're expecting to have that available within the next, let's say, 7 to 10 days. So in conclusion, the number of reported tick-borne diseases in New Jersey and nationwide are increasing, but are likely underreported. Despite the high numbers of Lyme disease cases, for example, CDC estimates that the true number of infections is 10 times what is publicly reported. Using that estimation, the 5,000 plus Lyme disease cases reported in New Jersey in 2017 may indicate a true burden of about 50,000 cases. Identifying new, emerging, or rare diseases is particularly challenging because we rely on clinician awareness to suspect these diseases and to reach out to public health for access to specialized testing. By their very nature, these diseases are rare and so may not be on the list of their differential diagnoses. Both travelers and ticks can introduce diseases into new parts of the country and the world, and New Jersey's highly mobile population increases our risk for those travel-associated diseases. And having strong human and tick surveillance is needed to both identify new pathogens and vector species of concern, as well as to monitor the vectors and pathogens we know are present in New Jersey. With that, I'll turn that over to Krista.
Thanks, Kim. And I'm just going to wrap up this webinar talking a little bit about some of the education resources and strategies that we have in terms of tick-borne disease prevention. So the New Jersey Department of Health's vector-borne illness website features several types of health education materials geared towards the public. All of the materials can be accessed on the website listed at the bottom of this slide. Our Tick-borne diseases brochure was updated in August 2017 and explains tick-borne disease symptoms, transmission, treatment, and prevention messaging for New Jersey residents in simple language that is easy to understand. The State Health Department has printed copies of this brochure available in limited quantities. If you would like to have brochures mailed to you, please email me. My contact information will be listed on the last slide. We also have short tick safety tips video available on YouTube. This is a 3-minute video which focuses on key messages to know where ticks are, keep your yard clean, wear long sleeves and pants, use repellent, and protect your pets. The video also demonstrates how to safely remove a tick and to talk to a healthcare provider right away if you experience tick-borne disease symptoms. Similarly, the How to Remove a Tick flyer takes the steps to safely remove and dispose of a tick and lists them in easy-to-follow steps with pictures. Lastly, the website also features a flyer with photos and clear messaging on how to avoid tick bites and perform tick checks in order to prevent tick-borne diseases. Also on the New Jersey Department of Health vector-borne illness website, there are tick-borne disease resources for public health professionals. We have a link to the Connecticut Agricultural Experimentation Station's Tick Management Handbook, which discusses in detail ticks of the northeastern United States, tick-borne diseases, personal protection, integrated tick management, and other tick control strategies. We also link to the CDC's Tick-borne disease reference manuals for healthcare providers. This manual features an overview of the ticks that spread disease to humans in the United States, maps of the tick-borne diseases reported in the United States, and goes through the incubation period, signs and symptoms, general lab findings, and lab diagnosis for several tick-borne diseases. In addition, in August 2017, the Department of Health hosted a tick-borne disease basics training webinar to assist local public health staff in conducting community education sessions on the basics of tick-borne diseases. Key messages of the training webinar included avoiding tick-infested areas, wearing EPA-registered insect repellent, wearing long sleeves and pants, performing tick checks after being outdoors. The presentation also discusses how to safely remove an attached tick and to call a healthcare provider if you experience symptoms of a tick-borne disease. The webinar is now available in an archived version, which can be accessed on the GoToWebinar link on this slide. After completing the archived webinar training, participants will receive a copy of the slides with accompanying script, a participant pre- and post-test, a program evaluation form, and a program report form. The training webinar is directed towards local health educators, public health nurses, maternal child health workers, and community health workers that give presentations in the community. Moving on to education strategies, there's really no one-size-fits-all approach that will work for every organization, facility, or practice. So I'm just going to present some of the ways that the Department of Health spreads tick-borne disease prevention messaging, and these strategies can be utilized and modified based on your needs and capacity. As I mentioned in the previous slide, many local public health professionals go out into the community to give presentations, distribute health education materials, and answer questions from the public. Some of the outreach events in New Jersey that have included education on tick-borne diseases are at health fairs, agricultural fairs, community centers, campgrounds, senior centers, zoos, gardening programs, schools, and daycares. Just to give you an idea of the range of events and partnerships that can incorporate tick-borne disease education. One of the reasons why we're holding this webinar today in the month of May is because May each year has been designated as Lyme Disease Awareness Month in New Jersey. This proclamation was established to recognize the importance of prevention, early detection, and effective treatment of Lyme disease throughout the state. Lyme disease is endemic in New Jersey with over 4,300 cases reported in 2016. However, we do not want to overshadow other important tick-borne diseases in New Jersey. So we're looking to modify Lyme Disease Awareness Month and turn it into Tick-borne Disease Awareness Month in upcoming years. Either way, having a designated month to acknowledge tick-borne disease prevention, detection, and treatment in New Jersey demonstrates the significance of these diseases and highlights the need for better education. Observing May as Lyme Disease Awareness Month is a great way to kick off the spring season and promote messages to help prevent, identify, and treat tick-borne diseases. Also on the Department of Health vector-borne illness page, there are links to individual pages for reportable tick-borne diseases: babesiosis, Ehrlichiosis, Lyme disease, spotted fever group rickettsiosis, and tularemia. Each individual disease page features the Communicable Disease Chapter Manual, investigation worksheet, links to CDC, frequently asked questions, and other education materials specific to that disease. You can access these pages by visiting the Diseases and Health Topics A to Z list at the website listed in green and clicking on the first letter of that disease name. Social media is becoming a progressively regular platform among clinicians and public health professionals to share information with the public and track or predict diseases. Using social media in public health can provide timely and relevant information of public health importance and can be used to engage the public and communicate key public health messages. However, you need to use caution when obtaining information from social media. Some accounts are not regularly monitored, and the information may not be correct. Further, myths and rumors spread quickly online, so always make sure to utilize credible and trustworthy sources. Credible sources include national and international resources, such as CDC and the World Health Organization, or WHO, and state and local public health agencies, such as the New Jersey Department of Health and local health departments. The New Jersey Department of Health is very active on social media. We have accounts on Twitter, Facebook, Instagram, and Snapchat, and encourage you to follow us and share the content that is applicable to your communities. Social media is not a replacement, but a complement to more traditional methods of information sharing. Radio, TV, newspapers, and email are still relevant and valid for much of the population and should be used in addition to social media to promote information about tick-borne diseases as well as local outreach events. The New Jersey Department of Health utilizes press releases, which are posted on our website, and the New Jersey Local Information Network Communication System, or NJ Links, which houses our Health Alert Network messaging system. Public health professionals within the Department of Health, links agencies, local health departments, and local healthcare partners are encouraged to register with links to receive messages regarding disease outbreaks, emergency notifications, seasonal and reportable disease surveillance information, and continuing education opportunities. Lastly, the New Jersey Department of Health has a reportable disease statistics posted online and goes back to 2004. Reported case counts for babesiosis, Ehrlichiosis, and anaplasmosis, Lyme disease, Rocky Mountain spotted fever, and tularemia are available. Reported cases are shown as a state total and are also broken down by county. Technical notes that contain the reporting criteria are also available. And with that, I think we're actually over our time. However, we are gonna, we'll stay on and we'll answer questions. If people have to jump off, I apologize, it's a little bit after 11. We are recording this webinar and we will be emailing everyone a link when it's posted to our website. So if you have to jump off and you want to come back and get the Q&A, we'll continue to record that. And so we have some questions that people already typed in, but go ahead if you have any other questions right now that we will have our speakers answer, and we'll get to the Q&A. You just want to read the question and the answer? Yeah.
I go first.
Yeah, read the red.
I want to type in here.
No, you're going to talk.
Oh, type.
No, don't talk.
Oh, speak. Oh, sorry.
Say the question and then answer it.
Okay, the question, what are some natural predators that help with tick control? Well, there's a number of them. First tried was a wasp back early in the century to control the dog tick. It didn't really work that well. There is a fungus that is currently being looked at by Rick Osfeld's group in lower New York State as to spread and kill the black-legged tick. Some people have tried nematodes, and there are other targetable approaches, but so far none of them seem to be useful on a wide scale yet. So thanks for the question. Okay, next question. How long must an infected tick feed to transmit disease to human? Most of the studies addressing that question are with the Lyme spirochete and the black-legged tick. And most of the studies are done in animals, of course, because you can't do them in humans. And most of the animal studies show that it takes 36 to 48 hours to transmit the spirochete from an infected tick to an animal. And that's because there's a specific relationship with the spirochete being in the gut of an unfed tick. It needs to be mobilized by the blood meal to move into the salivary glands, and that takes at least 36 to 48 hours.
Hello, this is Andrea. I'm going to be answering some questions now. First, does the longhorned tick feed on birds? The answer is occasionally. This is based on data in its other parts of its range. We do not have any data from New Jersey yet, whether it would feed on birds here, but in other parts of its range, it does occasionally feed on passerines and ground-dwelling birds, like, for example, kiwis in New Zealand. Something to keep in mind, but we're very interested in finding out if it will feed on birds here, especially because of the risk of using them for dispersal. That could be a way for it to expand. Who is identifying the longhorned tick in New Jersey? So the way that it works is for every new county, every new site of detection, it has to be confirmed by the lab, the National Veterinary Services Laboratory in Ames, Iowa. So even if we make a local identification here, the ticks will ultimately have to get sent to NVSL to have that site added as a confirmed site. So I believe, as Kim had mentioned, the Department of Agriculture is working on getting some resources up. So if residents have ticks that they think might be the longhorn tick, that's a way for them to be submitted and potentially identified.
Can you explain what NVSL is?
Oh, sure. The National Veterinary Services Laboratory is part of the USDA, United States Department of Agriculture, and I think it's part of APHIS, the Animal Plant Health Inspection Service. And so there's a tick component there, and basically it's their job to identify ticks, and they have resources available of ticks from all over the world that they can use to do morphological identification. And so their word is kind of gold. So what's the next question? Oh, so okay, tick testing resource that we can refer our residents to. So there are a number of labs that do private tick testing. If you look on our website in Monmouth County, I believe the URL is visitmonmouth.com/mosquito. If you look under, there's a little graphic of a tick. There should be a bullet point that says private tick testing labs. And we've compiled a list of labs that we know test ticks from the public. This is not an endorsement of any kind. We haven't evaluated them in any way, but that is a list of labs that we know are in existence, if that is helpful for people. So that's on our website, as I mentioned. Any other questions? Okay, Kim's taking over.
Okay, hi, this is Kim. A question, is New Jersey number 3 in the nation for tick-borne diseases, in part because New Jersey does a lot of tick disease testing? That could certainly be part of the reason, but diseases tend to follow the distribution of ticks, and the Northeast and the upper Midwest just have a lot of ticks that are vectors for human disease. We have high populations of ticks. The testing that we've had in ticks has shown that they are carrying pathogens, and we have a lot of people who are encountering those ticks. However, I think it is probably also in part because since we are in such a Lyme disease endemic area, there is a lot of public and healthcare provider awareness and concern. So certainly provider practices and testing, I think, is a factor. Question is the state considering initiation of statewide tick surveillance? Certainly something we're considering. We don't currently have that in place, and something we need to look at in terms of human and other resources. And again, in a state that is highly endemic for tick-borne disease, we would certainly be we would have different objectives than let's say a state elsewhere in the country that maybe is a location for emerging tick-borne diseases. Should we be concerned of a lethal viral hemorrhagic fever as a potentially emerging tick-borne disease? I don't think so. And again, just because ticks are associated with certain diseases in other parts of the world, we don't have those viruses and those bacteria here necessarily. So just because it's associated with something in China does not mean we have that naturally in our environment. However, we are certainly working with partners to obtain these new ticks and to have them tested for human pathogens at CDC so we can better characterize what that risk might be. Is it helpful to take a picture of the tick or collect it for additional information? And there was a question of whether testing is recommended for ticks removed from humans. In general, we don't recommend testing of ticks that are removed from someone, and that's because if the tick tests positive, it doesn't mean that the tick was attached long enough to actually cause disease in the person that removed that tick. Or if the tick tested negative, it doesn't mean that the person had been bit by 5 other ticks that did have a pathogen. So it actually can provide, I think, very confusing messages to the patient and perhaps a false sense of security. So routine testing of ticks removed from people is not generally recommended. However, it might be helpful if the person knew what type of tick they had found on them and if they developed symptoms and saw their doctor. There is also a recommendation for post-exposure prophylaxis in endemic areas for Lyme disease, where you need to know if you had an attached deer tick for a particular period of time. So it's not a bad idea for the resident to know what tick, if they removed a tick, particularly if it had been attached and engorged, to share that information with their physician, who then may make laboratory testing recommendations best based on that. But in general, we don't recommend testing of individual ticks. And a question, does one always get a bullseye rash when infected with Lyme disease? About 70 to 80% of patients will develop that rash, but 20 to 30% will not. And perhaps rely on those same nonspecific symptoms, or it may go initially undetected. Can any of the tick-borne diseases be spread by mosquitoes? Not that I'm aware of. Let's see. Are specific New Jersey counties considered highly endemic for post-exposure prophylaxis? I'm assuming this question is for Lyme disease specifically. Post-exposure prophylaxis is not recommended for any other tick-borne disease, only Lyme disease, and yes, the entire state of New Jersey would be considered an endemic area for that. And it's also important that that post-exposure prophylaxis is a single dose of doxycycline, not a full treatment regimen. I think that's most of the questions. We might have some additional, we have some questions on pesticides, which I'm not able to address, but we can certainly try to get these answers and send them out by email, so we'll try to do that.
All right, again, thank you very much. Sorry we ran over time. I just want to remind everyone that you will be sent a link to the evaluation, and you need to do the evaluation in order to get your credits. I will probably send the evaluation link later today, and you'll have 5 days to do it. If you do not do the evaluation, you will not receive credits. And then I just wanted to give you a slide with all of our contact information. As Kim mentioned, there were some questions that we weren't able to answer, so we will try to get you those answers and email them to you. And if you need to contact us for any other reason, this is our contact information with our names and email addresses. And we would just want to thank you guys very, very much for attending today. And again, this webinar is being recorded and will be posted on the New Jersey Department of Health website, and we will email everybody with a link to that once that's posted. So thank you very much.